If you are just joining us, this is now streaming Money Live program, and we are on the discussion. World Physiotherapy Day 2025, movement is life and healing is hope. Today we honor and celebrate the dedicated professionals who help people regain mobility, manage pain, and achieve optimal physical function. We appreciate their expertise, compassion, and commitment to improving lives. Your work makes a significant difference in the life of your patients. Happy Physiotherapy Day to all physiotherapists and those who have benefited from their care. May we continue to recognize and appreciate the vital role they play in promoting health, wellness, and quality of life. And to all the physiotherapists out there, thank you for your hard work, dedication, and passion for helping others. You are making a real difference. Thank you so much. And of course, this morning we will be celebrating the 2025 Physiotherapy World Physiotherapy Day, as said earlier, and we'll be looking at the topic, the role of physiotherapy and physical activity in healthy aging. We will also consider the theme for this year, which says healthy aging and prevention of falls. I'm Femi Ogundare, your anchor for today. With me in the studio is my amazing co-anchor, Somtoshuku.
Thank you so much.
Okizo.
Thank you so much. Thank you.
And of course, we have Dr. Favor Charles, who is a physiotherapist and also a member of Nigeria Society of Physiotherapy. Dr. Favor Charles.
Good morning, sir. Thank you.
Thank you for being with us this morning.
Thank you once again for having me. It's such a pleasure.
That you look very stunning.
Thank you. Thank you. Thank you so much.
And viewers, we advise you to join this conversation as you call us through the number shown on your screen or send us comments through any of our social media platform. And quickly, let's go into our question. I want to ask you,
Yes,
can you
sir.
tell us about the World
Physiotherapy Day?
That's like today is the World
Yeah.
of Physiotherapy in Nigeria. Can you tell us more? Can you please enlighten us more?
Okay, so the World Physiotherapy Day, it's the 8th of September every year. We celebrate it globally around the world. So it's a day that is dedicated to raise awareness for physiotherapy, to make people know about the importance of movement, to help prevent disease, manage conditions, and also to improve quality of life at every stage. We try to go out, reach out to people, do outreaches, sensitize people on the knowledge of physiotherapy, and celebrating it allows us to educate people on the profession, to be able to advocate and speak up for the service of physiotherapy as well.
All right.
Yes, sir.
All right. Thank you. Thank you so much. What can you please tell our viewers what the theme of this year's celebration is all about?
Okay, so the theme of this year's celebration is the role of physiotherapy and physical activity in healthy aging.
Okay.
Yes, so it's basically, the theme is helping us understand that as people grow older, they would be experiencing certain, there's some degenerative conditions that happen and in the body, and staying active and having access to physiotherapy and exercise would help make the difference in aging and strength. So when as a person starts to age, there's tendencies for the body to also be weak, to start having degenerations. And when you have physiotherapy, it's not just about maybe when the person is even sick, but staying active, because there's the role of physiotherapy and physical activity. So staying active would help the older adults to prevent them from frailty, from falls, from dependence, to manage them, to prevent these conditions that we see here, to help them recover from the health challenges that they might encounter as they get older, to help them live longer and healthier. So basically that's it, yeah.
Okay, please, can you explain to us what a physiotherapist do? What is the role of a physiotherapist?
All right, so physiotherapists, we are medical health practitioners. We add life to years.
Okay.
We help in rehabilitation, promoting recovery. So now health at health is like a condition where there is no ailment, where there is physical, psychological, all of that, a state of being in a good state of health. It's all encompassing. That's physical, mental, psychological, physiological, and everything. So physiotherapists, what we do is we help add life to years. Now, in cases where there is a condition, we help to promote healing. In cases where there is already a disability, we help to improve recovery. We also help to prevent these disabilities by incorporating physical activities into our treatment procedures, helping making sure our patients that come into us, they live active and independent to be able to live their life better, basically.
Okay, I right from when I started to gain knowledge about specific fields in medicine,
yes,
I think, or I got to understand that physiotherapy deals with just bones.
No.
Bones, is that really what physiotherapy is? It just about bones, or
it's not about bones? There are actually like seven different aspects of physiotherapy. We have the orthopedic and musculoskeletal. Okay. That's the only aspect that deals with bone. We have the neurology that deals with people that have special conditions like children with cerebral palsy, spinal cord injury, stroke. We have other autoimmune diseases like autoimmune is like muscular dystrophy. We have other special connective tissue diseases like all the other ones that affect people based on their immune system. So we have a couple of diseases, even Alzheimer's, even people that have even dementia, Parkinson's,
Okay.
We manage conditions like that. We have the pediatrics, women's health physiotherapy. We have sports physiotherapy. We have geriatric, which is for the old people. Like today's topic that deals with the role of physiotherapy and aging, the geriatric health physiotherapy, they take care of older adults, so pediatrics for children. We have sports, we have community health physiotherapy. There's just like a whole lot. There's also the ICU. Those are the cardiopulmonary that deal with like unconscious patients, people in the ICU, just like that. So there are so many aspects. It's not just bones. The only aspect that deals with bone is orthopedic and musculoskeletal. The rest are far from that.
So what can you say about the practice of physiotherapy in
Nigeria?
Yeah.
Well, the practice of physiotherapy in Nigeria is growing now as opposed to before. Before now, there was not much awareness on physiotherapy, but now I feel like Nigerians are beginning to embrace that physiotherapy is not just about rehabilitation or, like you said, like bones.
Yes.
It's now like they have like a broader knowledge of knowing that, okay, it also helps like prevent diseases, also helps in like wellness and healthy living, but there's still the challenges of like maybe people do not understand fully yet. They feel like, okay, still if you refer them for physiotherapy, it's just something like you said. He talked about in our previous session about bone setters, and these are things that we can just get it now. It's not just massage. There's still that limited education. There's also inadequate facilities that we as physiotherapists sometimes experience. And then when you compare the physiotherapists that we have now to the population size, like it's like they are little to the large population size. There's still a little bit of challenges here and there, but the good news is that any Nigerian that engage in physiotherapy or has come for a physiotherapy session, when they go, they have the testimony of, this is a part of the health sector that they've even not seen before, and they're able to like help the other people to understand better, so it's just like I said, it's something that has been growing now.
While you were speaking, you spoke about fall and frailty in the elderly.
Yes.
And of course, I want to ask you, in the recent time, we have seen that people have conditions like osteoarthritis.
Yes.
That is the tearing and wearing of the joints,
yes,
especially the nail, and of course the lumbar spondylosis.
Yes.
The wearing and the tearing of the back lower joint. Right?
I didn't know you were vast in this. I'm surprised the terminologies you are just using.
Don't worry.
I'm so impressed.
I'm
very impressed.
Thank you so much. Thank you so much.
Yeah.
Of course, in those people who are still in their 40s and 50s, and you are speaking about fall and frailty of the elderly. But those people in their 40s and 50s are having these osteoarthritis and the lumbar spondylosis.
Yes.
What could be the responsible? That's number one. And what are the measures that we can put in place that when we are still in our 20s and 30s, we can avoid such?
See, when we are still in our 20s and 30s.
Yeah, I'm not yet in my 20s.
This man is a yippee man. Okay, so for the people in their 40s and their 50s who experience osteoarthritis and lumbar spondylosis, there's like a lot of reasons why. One that stands out is hereditary. It could be like, you have a family history of osteoarthritis, you have a family history of lumbar spondylosis. This can also predispose a person in their 40s or 50s to have it. There's also sedentary lifestyle, people who do not engage in any physical activity. They're always just sitting down in one place, just enjoying life, literally. There's the poor posture as well. So maybe like for the lumbar spondylosis, it could be a result of poor posture. You sit down for a very long time. Your job is one that requires you to sit down for the entire day. You don't have any ergonomic chair. You just sit down in a very bad position. Over time, there's wear and tear on your spine, especially for someone who has been working from his 20s till he became 40 or 50. That also predisposes him. Obesity is also one of those factors. Unhealthy diet is also one. When there's repetitive stress on a particular area, it could be your knees for the osteoarthritis, it could be the back, and obviously, like I said, the genetics, that's hereditary. And when you talked about prevention, how can we prevent someone in their 40s and 50s? The first thing I spoke about was the hereditary. That one, really, if you know that you have a family history of these conditions, what you now do is you start engaging early in physical activities. You start to train yourself to not just be sedentary, don't just stay in one place. Avoid stress. Avoid unhealthy diet. There's some diets that can predispose you to obesity. And when your body is too big, the knees are the weight-bearing joints of the body. When a person is obese, it tells a lot on the knee. The person is unable to walk as much as they can, and over time they start to hear crepitations in their lower legs. Avoid smoking and excessive alcohol. That's also something that people do not know. Smoking and alcohol is one of the risk factors to many conditions and diseases in this world. Obesity or stroke or hypertension or smoking and alcohol intake excessively is bad. I am an advocate for no smoking and no drinking. So I'd advise that anyone in their young 20s, 30s should avoid smoking alcohol, because in the long run it predisposes you to so many things that even you will be surprised. Not just even the lung cancer and all of that things that they preach so hard. The little things like all of this, right? And also to just engage in regular exercises, strength exercises, flexibility exercises, just to keep your joints as active as possible.
All right, you spoke about sedentary life.
Yes.
Like sitting
in
a place for long.
Yeah.
But what of those people who sit for long and they do something? For example, like medical doctors.
Yes.
They sit for probably hours consulting.
Yes.
Probably to the tune of 30 to 40 patients.
Yes.
Will that be applicable to them?
Yes, for them, because the nature of their job. So a medical doctor can sit for hours consulting, but at some point you also get up, maybe go to the ward, check on these patients, go around, climb stairs and all that. So for people whose job require them sitting for long hours, what we advise for them is take breaks. It could be inside your office. You could just take a 30-minute walk back and forth. When your legs are down, try to do ankle pumps just to ensure that blood is flowing continuously. You take a little bit of turning, just to pop your bones, and don't just be there for a long time. Especially for people who on their laptop 24/7, 70 years of their life, like they're just there. Over time, when you check it, exactly, you see their neck. Cervical spondylosis is one thing that I have had so many patients cervical and lumbar, because even when you hold your phone like this, you'll be doing like this. Like there's a proper technique for holding your phone, there's a proper technique for laptop usage, everything, even for bending down to write. So I feel like these are things that they should also know. So people who have jobs that keep them in a place for a very long time, they should be able to incorporate these breaks in between, and then also help themselves to not become, even when you maybe on Saturdays you can just take a walk, go to the gym. If your job is one that you work from Monday to Friday, and you know that you're always, take your eyes off the laptop, take your eyes off your phone, take your eyes off, just do something active to help yourself.
You spoke about cervical
yes,
spondylosis.
Yes.
And of course, we have that of thoracic.
Yes.
Don't you think there are things that could be done except from exercises?
Yes.
Probably things they can do, those people who have this sedentary work schedule, they can do in probably avoiding to have this problem.
Like, apart from exercises, you can also do proper posture, like I said. Because their posture is also something that predisposes them. Because there are two things here. They have jobs that make them sedentary. So it's not like they can quit their job. If they have the opportunity or maybe the option of doing that, they would do that. But if you know that you're someone that your job is something that requires you, then you should also be mindful of your posture, like the one for thoracic and cervical and lumbar, right? So even when you're working for long hours, You just have to. You cannot. If you even sit down for a very long time, you start standing up, you'll be tired. So you adjust your back, because you can put pillows behind when you're sitting down for a long time. That would also help cushion your back. You could get there are ergonomic chairs that people use, that there's the way it's shaped in your office. You sit down, it helps to keep. So no matter how long you're sitting down for, those are like, it helps prevent occupational hazards, because occupational hazard is not just falling down at work and injuring yourself. Occupational hazard is developing a condition or even an ailment just by being in the space of around where you work. So yeah.
Thank you so much. I think I'm a victim of this, because my job requires me to sit.
We have Dr. Favor.
Yeah, to sit at a, and I still don't have that ergonomic chair.
Ergonomic chair, yeah.
So we'll consult for you for free.
Ergonomic chair. I still don't have it. So I'm going to use this opportunity to probably call out to speak to my office. Probably we have a doctor here, and our jobs requires us to sit for long hours. So probably we should put that into consideration to avoid our necks becoming like this, right? Okay. My cervical.
And your lumbar too.
Okay. And my esophagus. all right. Okay, you said something about bones popping. Yeah. And it's bringing me to, there is these things we see online where somebody lies you down and bam, the next year bam, they tie something like a rope to your neck and they drag it. Every part of your body is just doing bah, 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 bah. Yeah. Okay, I want to ask, is that actually healthy to regularly pop bones? Like, what exactly does it do in the human body?
Okay, so the releasing of nitric oxide bubbles, the gas, like when you do this in your hand, you hear this sound. So it's nitric oxide that is just like escaping, like bubbles. Exactly. This is fine. It's okay. Right? Yeah, it's okay. It's fine. But those videos you see online, those are chiropractors. So
are they not physiotherapists?
They are not physiotherapists. Okay. They are specifically just for that. It's like a manual. It's a specialty. It's chiropractor.
Read in the university.
Yeah, people read it in university.
That's a course on it. So.
But I've not seen a particular medical, like, even when I was in school, I asked the same question, because I don't think there's a course. Yes, a medical body on that thing. But I know that people have, like, it's like a skill, like a technique, right? People learn chiropractic. So one thing I would say for that one is you have to be careful. Because you can go somewhere now and they will pop your back and they will pop it for you. So what we as physiotherapists advise is, if you have a pain in your back, maybe like, take for instance, with lumbar spondylosis, there are manual therapy techniques that we do, right? We have Mackenzie's, we have Maitland, we have different grades, lumbar oscillatory, rotation techniques. There's so many things that we do. And we have techniques. When I say techniques, when you have skills in doing something, so there are techniques to doing these things. So when you're doing them, you're not just popping and popping, like you're doing it along the normal biomechanics of the spine. So your patient is not at risk of developing a spinal cord injury from doing that. But if you go to someone who's not professionally trained and the person starts to pop your back, tendencies for you to even have a spinal fracture or even a spinal cord injury, But chiropractors that are well trained and licensed, because there are two things, well trained and licensed, yes, you're free to go to a chiropractor if you feel the need to. But many times if you have maybe a body pain, you go to the hospital, see a general practitioner, you get referred to see a physiotherapist depending on the condition, and then you're treated according to the guidelines, because we'll do an assessment, there's a consultation assessment session that has to do assessments, you have to do tests, we do special tests, then we cannot diagnose the condition before we now do like our treatment plan of care, and then treat. You get. So even with that, we have a session of physiotherapy that do that popping thing, but it's called manual therapy. It's under the orthopedic physiotherapy and musculoskeletal physiotherapy. So that's manual therapy. Okay.
Sorry, to just do a follow-up question. Also, what can you say about receiving massage?
Massage.
Yes.
You mean the spa?
Yeah, the spa.
From who? From your wife or from
No, there are spa salons where you just. I'm just asking, do they also help
relax?
And secondly, what can you say about beds? Because I realize that most people, when they sleep and wake up and they get up from the bed, that is like the first point. My back, my this, and so please, and the spa, and also
Okay,
Which
so
type of bed will you advise?
yes,
as a professional?
yes.
okay, so it's good that you mentioned as a spa, because putting it out there, physiotherapists are not masseurs. We do not massage. Yes.
Because I really
yes,
feel
I
that's
understand.
part of
Like,
what
it's a
you
common
do.
stereotype. It's a common stereotype. Like, we don't give full body massages. Massage is a technique that they teach us in schools, because we know that there's certain conditions like swellings, and if you want to mobilize treat a patient that has swelling, there's bandaging, there's compression with bandage, and then you can massage using effleurage technique, light stroking, to drain the fluid towards the lymphatic drainage. That is like one of the reasons where massage can. And then if there is pain, using ointments, after you finish treating in a particular area, you can apply the neurogesic ointment and then massage the area. But it's for specific conditions, not every condition. You cannot be massaging a condition that does not need massage. They're just specific condition. And then there's also tactile stimulation. So there are different aspects of physiotherapy.
That lies
One
down and then they are doing their backs like this, their necks.
okay, no, those ones are masseurs.
Okay.
So for a masseuse, now
Do
what
you
you ask,
advise that? Do you advise that?
yes, I advise masseuse. You can go to the spa for relaxation. I personally, I go for spa sessions. It's very relaxing. I mean, princess treatments, because you can go, we all can go for spas. It helps with relaxation, increasing blood flow to your body, really, just general relaxation. It's very good. And I'd advise massage, but you have to go to a spa where they'll give you a full body massage. If you go to a physiotherapy clinic and they treat you and you're demanding a full body massage, sometimes it might be, you might be angry with them if they tell you no. This is just me telling you in advance that that's not their job. That's why they always tell you, oh no, we don't give full body massages here. We just treat you according to your condition. Then if you need a full body massage, you can always go to the spa. Then the second question you asked was what?
Beds.
Okay, yeah, for bed. Orthopedic beds are good, right? But you have to get the original ones, orthopedic beds. But one of the, those beds that when you sleep, it enters inside.
Yeah.
It's not good.
No.
Some mattresses are too soft. And then you sleep and then your body starts to touch even the wood or the bunk or the iron of your bed. That is very unhealthy. And that thing that I can also advise is sometimes don't sleep with very big pillows. If possible, don't sleep without pillows. Your pillows should be very flat, because it causes neck pain when your pillow is too higher than your. So it's just like your neck is like this and your body is like, there's just this, it's like a slope. Do you understand? Your neck will start to hurt. You wake up with your body pains.
So
and
is there a particular posture? Because I've seen things they say, okay, there's a particular posture when you sleep like this, you're affecting your spinal cord. When you stay, so is there a particular posture?
I personally would advise you just lie on your back.
Wow.
Yes, but if you feel like, because if you just lie on your back, lie straight like this. Sometimes you can lie without a pillow, and then you can also lie facing, like lying prone or supine. Like prone is like forward like this, supine is like on your spine, literally. So you lie like this. And if there's your pillows are not too big, you can just put your hands by the side. Over time, if you start to develop good sleeping posture, at first it might be uncomfortable, but if you develop a good sleeping posture, over time you get comfortable with it. Yeah, especially that pillow thing. People always find it difficult, but pillows are one of the reasons why people have neck pain.
I'm talking to me, please.
Okay.
That's the truth.
Speaking about good sleeping posture, yeah.
You don't have?
There are certain times you're like this. Your leg is here, and that is like the favorite. It's like the best. The moment you hit, very comfortable. Your leg is here, your neck is like this, and you're gone. You stay like that 5-6 hours, and when you wake up, you feel exactly.
And it's okay as long as you're sleeping like this now, and your back is your spine is straight. Because you just need your spine to be straight. If you are bent, if you still bend and your spine is bent,
it's the bending I'm talking
okay,
about.
You mean
There's certain ways you bend, and then you just.
And it's possible that over time when you might also need to bend your spine at some point. I'm saying that the ones that cause pain for people are when they don't sleep properly, and maybe they sleep on their hand and then they wake up and they start to feel like blood is not there, or maybe they bend their body in a way and then they start to feel pain on this other side. But if your body feels tired generally and you adopt a posture that works for you and you sleep well, as long as you're not putting your head on the floor and your legs up, as long as you're sleeping in a way that is you feel better when you wake up, then it's fine. Just be mindful of the bed you're using to sleep, the kind of mattress, and then your pillows. I think it will help.
Now quickly,
Yeah.
neurologists advised that people who snore should not sleep with their back, because some people, they are prone to snoring when they sleep with their back. So now you are advising us as a professional.
That's why I also said you can also sleep forward. So you can like sleep like forward, like you can also sleep by the side, right? But be careful to not sleep on one side of your body, and when you wake up then you start to feel numbness.
Okay.
So you can turn from time to time. You can sleep like this, just so that you're not sleeping on one hand and then you wake up and your hand is, but you can also sleep like this, like forward.
All right, Dr. Favor, I want to take you on a short memory lane.
Yeah.
When I was in the village, we have this local. I'm serious, and it's very effective.
Very effective, guys.
Local women, women,
Yeah.
very peculiar to them.
Okay.
That treat this dislocation
Okay.
more of part of your work.
Yes.
And they do it effectively.
Okay.
In fact, they will even, it's a traditional means anyways,
Yes.
but then very effective and affordable.
Okay.
What's your take on that?
Okay, personally, I do not recommend bone setters. And it's not just because I'm a medical practitioner.
Call them bone setters.
Yes.
But then, we call them traditional, professional physiotherapy.
Please don't put physiotherapists behind their name. They don't deserve to be called that. I personally have had experience of people who went there, right? And my dad, for example, he's had to like have the time he had a fracture,
Okay.
and his was quite bad, he was a gunshot injury and he had that on his hand. And he went to a traditional bone setter at the time where they just took him there sharp and they just, helped him. They put they'll put like sticks and they
They'll
bandage
set
it
it
and they
round.
set it
Please,
round.
yeah.
His hand is perfect. My dad's hand, he doesn't have any radial nerve injury. My dad uses his hand well. You still see the scar though, because they had done the suturing in the hospital, by the way. They did the surgery in the hospital and everything. Before coming there. Yes, they did the surgery in the hospital before coming to the bone setter. But even though the surgery at the hospital they did, by the time they did the surgery and then he went for they didn't do so much, to be very honest. He just helped with the whole this thing, but his hand is good. I don't think it's majorly because of the surgery. Some people will not do surgery, and I'm not joking, because some people will not do surgery. They will not do anything medical. They just go there straight. And now I've had patients come to me in the clinic. I've been privileged to work in, I think, 2 hospitals, like more than 2 government hospitals, about 3 private hospitals in this Abuja, right? And I've seen different cases. That's like 5 hospitals in total. And I've seen different cases of people coming back with they'll say, oh, we went to bone setter and then they developed maybe Volksman contracture, developed radial nerve injury. For this, I'm just using the hand as an example. That's the I've seen people with having to amputate them because what the bone setters did caused them to have gangrene and their legs started to decay and they had to cut off the limb. So because I know back then it used to work, like even the person that the father of medicine, the people that started medicine, I'm sure they started with things like all these herbs.
Yeah.
Everybody started medicine with herbs. People started these things with like small. They'll come, let's see how these things work. And then medicine became a beautiful profession from herbal things and natural resources, right? And I'm not disputing that. But now there is evolution. Technology has taken over the world, and much more. There are better ways to do things, and the medical profession is one that is ever developing. I would not advise that in this current day and age, something that worked for our fathers and our mothers back then that they used to do. Now that there is a better way to do things, why not come and then do it like this? Because so far, the stories that I've been hearing recently have just been bad.
All right, if I may ask,
that's
you said that of your dad
yes
worked.
Yes.
And I can say that after the surgery, he went to them and they did it and it worked.
Yes, what
That
they
means
even did.
They complemented what has been done.
Yes,
so
and what
I can see.
That's what I
from
wanted
you
to
said,
say.
that they were able to complement what the physiotherapists have done.
Yes,
Or the doctors have
what
done.
doctors had done. So because what he went for was not something that was, it was a directed maybe instruction. Okay, they should do this and do this instead of, that some of them just do without
As in
any
from the hospital.
from the hospital.
They gave a referral.
They gave a referral, and then he just said, okay, maybe his brother said, okay, let's go and see these people. And the person they even went to see was someone that, they've even done most of the work. What we're going to have to do here is not even anything, this thing, just put those planks and then tie it for him.
We cannot rule them out outrightly.
No, because the reason why I can't even say we should rule them out outrightly is because there's some rural communities where they do not have any physiotherapists there, and what they have available to them are these bone setters, which is good. But I would always advise they seek medical advice first.
Oh, okay.
Do you understand? because these are human beings that I'm sure if maybe your dad or your uncle was a bone setter and maybe something happens to you, that dislocation thing you said, they can easily pop the bone, and your bone will actually go back to the right place. I've had a situation where, this is when I was in camp, when I was in NYC 7, I had someone whose bone dislocated right there and there. His knee popped out of the socket. We had to fix it back in, and we popped his knee and put it back. It was very, very, but I'm not a traditional bone setter, and I did that because I am a professional and I know how to set a bone. I've done shoulder dislocation before, I've done knee, but if it's a skill they have, yes. But I would always advise someone should seek medical advice first before, because if you need surgery, they might not know you need surgery, and then you just go there and they'll do something bad for you. But if you and complicate issue, it's just the complications that I'm after. Because if what they are doing is not leaving people with damaging and life-changing complications, because imagine someone who they had to amputate their leg because the bone setter did not do something well, So that's just my own. So always seek medical advice. So we are saying first
now on national TV that those who are bone setters, calling themselves physiotherapists, is a misplaced of
very big one,
nomenclature.
Very big one,
right?
Yes, very big one.
Okay. What do you advise? Probably children that are born with, I don't know the name, but
they call it birth defects or deformity.
Bow legs.
Okay, bow leg. Oh, genome varum.
Okay, because I've heard cases of someone. This person told me itself. What they did was to tie her to a tree. I don't know how they did it.
My God.
They tied her to, and the leg
came back.
It became straight. She walks for the time. And also someone that they had to dig the ground and drop the leg inside of it. I don't know how.
But the process is very
yes, I don't know how. Yeah, so I think the person was tied to a tree, that particular leg was somehow tied to a tree, and I don't know how it happened, and then the leg became straight. But when we talk about children that are born with such, because it's actually something that when you see it breaks your heart. Yeah. As a physiotherapist, I don't know if it's probably part of the things you do.
Yes.
And okay, what do you advise such parents?
Okay, so if a parent has a child that has a bow leg, it's usually better to address it from when they're younger. So there's bracing. They do bracing for them, right? There's like standing and walking education they do for them, that you help them. There for children, you can even still do a little bit of soft tissue mobilization around their legs, And as they grow, with that bracing, especially the bracing, and then doing exercises, soft tissue mobilization, walking education, standing education, over time, as they grow older, the deformity starts to reduce. Like, you definitely see marked changes. And the earlier you notice it in your child and you take the child to the hospital to start physiotherapy, the better for them. You will see that they start to see improvement. Because one thing about physiotherapy is early intervention is like the quickest way to get your results. Once you see it happening early in your child, they'll start telling you things to do and you start doing them.
Okay. Lastly, you mentioned we talked about a union, and then you said you belong to a union. So I just want to ask, tell us what your union is all about. What are your duties, activities, and reach in Nigeria generally?
Okay, so the name of the union is the Nigerian Society of Physiotherapy. We are a professional body and we represent physiotherapists in Nigeria. Our major duties are promoting professional practice and education, engaging in advocacy and public sensitization, like what we're doing now about the importance of physiotherapy, organizing health outreaches, seminars, and community programs. We also ensure that there are ethical standards and continuous training for our members, like hosting CPDs, hosting conferences. Currently, as we speak, there's a conference holding as regards World Physiotherapy Day. Wow. Yes, there's a conference to that effect. We also go out for outreaches. Like I said, even on days like this, you see us in our t-shirts. We come out, we sensitize people, we promote this practice so that people know, we educate people, sensitize them, and all of that. So it's something that we do, and
all right,
it's also something
for the elderly who are down with falls and flirts.
Yeah.
What are the management options for them?
Okay, so for people that have fallen down, many times we would tell them to come in for physiotherapy, and we do like balance training, we do gait training, gait re-education, we do strengthening exercises. Because one of the things that happen with patients who are older, that frail individuals, is they're prone to falls. And the reason why they're prone to falls is because the muscles are weak, they're getting older, and so would advise that they come in We do gateway education. We do strengthening exercises. We could also help them with assistive devices like walking aids. We could help them with hip protectors so that when they fall, they will not, because the hip is very prone to being fractured. And to lead to AVN and all of those things. And then ensuring that in their house they have fall-proof. They have a fall-proof environment like rugs instead of tiles. They have slippers that have grips on there, so when they're matching their feet on the floor, they're not going to slip. Then there's good lighting so that they can see where they're walking. With a house that has stairs, they could install railings to help them, with movement, and then their nutrition, make sure they have rich diets that are rich in calcium. Make sure they drink a lot of water, and then from time to time they should go for medical care, like medical checkup. Make sure to prevent these things, like they should keep seeing their doctors, their physiotherapists, their nutritionists, because diet is also something that's very important in the elderly. Then what else again can I say? I think their family members should also be supportive of them. They should always have someone young and agile that is always around, maybe in the house. Maybe they are two old people, they should have maybe one person, like is a youth or a teenager in the house, so that from time to time they're able to call the person, to ask the person, run errands, do this, do that. That's something.
We have elderly who are to the tune of 90 years of age, some 100 years of age, and they do not have this fall and frailty problem. So I want to ask, is it not possible not to have it at all?
Yes, it is. It is very possible. It's very possible, because I feel like one thing that we do not understand is how that it's how this body is like a tool God has given to us. God has given to us this body, and it's how you manage your body that your body will manage you. And some people, they were very active when they were younger. They always took care of their body. They ate healthy diet, and this has enhanced them over time to be able to, even in their old age. You see someone that is 80, 90, he's still agile. Like someone that is 40 is still dragging his legs, you get. So this is why we're trying to promote the role of physiotherapy and physical activity, because the more you, as a young person, you live a healthy life, a physically active life, you would be able to enjoy your old age in the long run. So
Dr. Philo, sorry.
Yeah.
This is national television.
Yeah.
And we know our viewers are watching all over the world.
Yes.
Please, can you seize this platform to talk to the Gen Zs the way they live their life?
Yes, actually. I personally feel like this generation exposed to a whole lot of things. I'm going to start with the use of harmful substances, drugs, alcohol, all of those things. I feel like Gen Z should stay away from these things, because it is very detrimental to the health in the long run. Having a lifestyle where you just go clubbing, you dance, you do so on, come back home, sleep throughout the day, resume again, like not being active. You should engage in healthy activities like healthy diet, eating food that is nutritionally rich for you, food rich in vitamins, calcium, proteins. Take less calories, try to be very active, go to the gym, do exercises, avoid sedentary lifestyle at all costs, so that you'll be able to enjoy your old age.
Thank you so much, Dr. Favor. And because of our time,
yes,
we'd want you to give us your last words to our viewers.
Okay, healthy aging is not just about adding years to life, it's about adding life to years. When I say adding years to life and life to years, when I say you add years to your life, you're just getting older. When I say adding life to your years, is as you get older, you're living with vitality. Your life is not just about the number of years, but you're actually enjoying life, right? And so right now, you have to make sure that you keep moving, you stay active, you eat good diet, you prepare yourself for aging so that you're able to age properly and you don't start to fall sick and have these conditions in old age. Because enjoying your age, your life in old age is very beautiful. And so we advise our viewers that as you go on, always remember that even physiotherapy is not just for when you're sick. It's also a means to help you with, preventing of any conditions. So it helps you with preventing sicknesses, help you with promoting and rehabilitating you. If you feel, like you said, when you have just these little pains in your body, you can always go see your physiotherapist, get advice, just stay active, and you would enjoy your aging.
The
last words, Santosh.
Yeah, thank you for my last words. I would probably want Dr. Favor to just answer me this question as my last words. I am fond of like by the time we're done with this show now, you see me do my neck like this. Bam, bam. Do you advise that as a healthy habit, or?
Well, personally, why are you doing that? Do you have neck pain?
Yeah, sometimes like now I can't wait for us to end. So
So you can't do that. Okay, and
And you're not
it's
from
not
India.
it's not bad really. You're, like I said, you're just helping to release these gas bubbles in your in between your joint spaces, right? Just help yourself
Gas
release.
bubbles.
Yes.
I've learned that now.
Thank you so much, Dr. Favor.
So,
Thank
yeah.
you, my uncle.
And we want to appreciate Dr. for being with us this morning.
Yeah.
Thank you so much. It's a great privilege, which is never taken for granted.
Thank you so
for being
much.
with us.
Thank you. Thank you so much for having me. It was really, really, really great. Thank you.
Thank you, Dr. Favor.
And I would like to be your personal assistant within those people you will be consulting for within our facility.
Oh,
So
please,
if they want to
by
come
all
see you,
means.
they will see me first.
Definitely, he's my.
And then I'll be assisting him.
Oh wow! All right.
Of course, sometimes you could thank you so much for doing this with me this morning.
Thank you so much, my uncle.
Thank you.
And to our viewers, thank you for being with us this morning. And as we call it a wrap on today's show, we acknowledge and appreciate the profound impact and expertise of physiotherapists on individuals, families, and communities. We pray that posterity will be kind to them all. God bless Nigeria. I'm Femi Ogundare. Bye for now.